From the current news, it is evident that people in Thailand are suffering from complications of diabetes. Presently, statistical data indicate that the number of cases is steadily increasing both in Thailand and globally, especially in Thailand, where there is knowledge and a workforce with expertise. Efforts are being made to integrate technology related to diabetes management. According to statistical data, 74% of patients experience unmet health needs. Furthermore, 66% have not yet received a diagnosis. 23.5% of diagnosed patients still have uncontrolled diabetes. This indicates that addressing systemic issues is necessary. Our team has chosen to start the process by conducting a root cause analysis to identify critical factors affecting diabetes care. We are using stop and flow diagram to understand the dynamic of system and integrating causal loop diagram to pinpoint key leverage points. This analysis has revealed two pivot keys. 1. Accessibility to screening and diagnosis. 2. Ensuring continuous and coordinated care. With this understanding, our primary goal is to ensure that diabetes patients can easily access the treatment system and receive appropriate and efficient care.
Our intervention, DiabeEase Connect, aims to improve the management of diabetic care in Thailand through two main functions. 1. Expanding accessibility of diabetic care. We focus on making people enter to the healthcare system in the most efficient way, depends on area and culture, and promoting diabetic screening through integration them into daily life by cooperation with our partnership. And the second function is enhancing continuity and coordination of care. We envision a seamless network that links all stakeholders involved in diabetic care together, improving collaboration and communication between healthcare providers and patients. And our intervention seeks to facilitate the informational continuity across every stage of patient's journey. To make these two functions happen, we decided to build a strong central database system model. The system will serve as a reliable, accessible, and as a one-stop data for all diabetes patient information. We require the cooperation with healthcare providers in Thailand who can contribute us a real-time patients data to the central database, which is the Ministry of Public Health Thailand that controls all government hospitals and Thailand private hospital networks such as BDMS, BH, BCH, SVH, and RAM. This will enhance the connectivity of patients' information and optimize treatment efficiency. Our strategy is to develop and implement 4 applications that invented by the Thailand Department of Disease Control. These applications connect 4 groups of people within the diabetic care pathway, which is Village Health Volunteers or VHV, Sub-District Health Promoting Hospital or SHPH, specialists and doctors, and last group is Thai population focusing on diabetic patients and risk individuals. Organized information is perceived throughout the patient's journey, moving from screening, diagnosing, treatment, and the last step is control. At each stage, the information undergoes triage to determine the most appropriate treatment for each patient.
On the first step of the patient journey, we divided the screening process into 2 contexts, urban areas and rural communities. In rural communities, we take a proactive approach by having healthcare providers or village health volunteers go directly to the field with the VHV application. This application has been enhanced and implemented to make it more systematic, user-friendly, and practical. First, the application includes a central risk assessment tool known as the Thai Diabetes Risk Score. This tool assists village health volunteers in screening for diabetic patients and ensure a standard level of basic screening for everyone. For those identified as at risk, according to the Thailand 2022 diabetes guideline, blood glucose level will be tested using a provided blood glucose meter. Second, all information gathered is recorded in the Health Data Center or HDC. This central system connects and transfers data between the public and healthcare professionals. This ensures that important health information is accessible and up to date. Finally, risk score and individual blood test results are sent to the patient based on the 7-column model framework, which categorizes patients into 7 groups and provides specific behavior modification recommendations. The public can continuously track the result via a citizen application and line chat, which cover all the age groups. In densely populated urban areas where there is a greater access to media and technology, we emphasize a patient-based approach to encourage individuals to seek screening. First, we are standardizing and increasing the accessibility of central risk assessment set through online websites and citizen application. Additionally, we are lowering the age for assessment from 35 to 15 years old, giving the increasing prevalence of youth onset type 2 diabetes. Second, we will integrate the assessment into daily routine to motivate people to complete it. This involves partnering with many companies and stores that are subject to sugar taxes. We will propose tax reduction for companies that assist in monitoring employee assessment or promoting customer assessment. We will run campaign offering discount and benefit to customers who complete the assessment, which we promote through fitness centers and other health establishments. Finally, individuals with high risk level will be notified to check the glucose level at nearby hospital or partner screening point. This information will also be updated in a central database and forwarded to hospitals. For individuals screened as diabetic patients, a general or community physician will conduct a diagnosis. If they determine that effective treatment is not feasible due to various limitations, especially in rural areas, they can consult or refer the patient to an integrated practice unit or IPU for diabetes at district or provincial hospital. This referral process can be facilitated through the doctor and specialist app, which will manage and forward all the collected data since screening to IPU, ensuring continuous and cooperative care with enhanced efficiency.
To increase efficiency of primary care and value orientation, Integrated Practice Unit or IPU strategy is applying our system model to provide an efficient value-based system. IPU are multidisciplinary teams that are ideally correlated to provide full cycle of care for the specific condition. The team involves both clinical and non-clinical personnel working together. After we define the patient segment, IPU staff will initiate the treatment plan for a specific patient and covering the primary to the preventative care needs. All the plan will be correlated with patient enrollment, condition and needs, and also doctor capacity. So with our platform, community doctor will continuously consult with the virtual integrated practice. Collaborating with the medical school will be a good start. It is mutually benefit as the university-affiliated hospital will get better roots of need of the community, providing transformative resources and advanced personalized medicine treatment for each diabetes patient. With IPU, patient focus to promote patient involvement. Shorter time in patient care. By streamlining process and communication channel, we can ensure that patients receive the care that they need in the timely manner. Specialty level clinic work practice by implement specialty level clinic work across all units. And one team responder, so one cohesive team will respond to the all collaboration of fragment unit responsible for one medical treatment, diabetes.
In summary, our intervention, DiabeEase Connect, aims to address the systemic level issue in diabetes care in Thailand by centralizing patient information with a central database system connected with applications. And we also introduced the concept of value-based IPUs in our model. This is to improve two pivotal keys, which are accessibility to screening and diagnosis. Second one is enhancing continuous and coordinated care.
This is our quarter-based annual plan for the following 3 years. In 2025, we aim to empathize with our users, start developing of both software and health professions capacity building, and also test it in a sandbox environment. For the latter 2 years, our aim shifts to intervention integration toward Thailand health system. In the meantime, we also broaden our connection for more marketing opportunities and fully launch our intervention at the start of 2027. As you can see, we strongly emphasize on closing our feedback by evaluating data and further developing our system for multiple times. This is to ensure that our system is truly sustainable in the long run with years to come.
To effectively measure the progress and success of the DiabeEase Connect initiative, we set up a set of key performance indicators or KPI based on the outlined strategies and goals. Our intervention consists of 5 main parts, ensuring all aspects are systematically developed, implemented, and evaluated. The first 2 sections are conducted to ensure that our intervention actually serves key objectives.
For the next part, the distribution of DiabeEase Connect finances. Our main portion of investment is toward the creation of IPUs and cooperation of multiple databases. Approximately a quarter of our budget is put into maintenance and legal action. The last used 10% are then invested into maximizing both the system and people potential included in this project. We also reserve around 200,000 or 20% of our budget for emergency uses.
Choose also intervention, DiabeEase Connect, to systematically and sustainably address diabetes, providing patient care from screening, access, and treatment through the completion of the treatment process. Healthcare does not have to be chaotic. Patients and families should not have to worry about coordinating their own care. Clinicians should not have to wonder who will provide the other service that the patient needs. Thank you.